Good day everyone, I am Maria Victoria Tolentino, student nurse from Nueva Ecija University of Science and Technology. And today I will be performing the obtaining fundic height, Leopold's maneuver, and also the fetal heart rate. For the assessment, determine the need for Leopold's maneuver, assess the client's over condition, determine when was the client last voided or was last tested for urine analysis, and we need to determine the last menstrual period and the expected date of confinement. And for the planning, allow adequate time to prepare for the procedure. This must be performed during the antenatal checkup. So for the equipment, we need the stethoscope, measuring tape, draw sheet or top sheet, antibacterial hand spray. For the implementation of obtaining fundic height, we need to check the physician's order, introduce yourself prior to the procedure and verify the client's identity, explain the procedure, why is it necessary, and how they can participate. Provides client's privacy as the client empty the bladder before the procedure and perform hand hygiene. Good day, ma'am. I am Maria Victoria Tolentino, your student nurse from NUST College of Nursing from 7 a.m. to 3 p.m. So, may I know your age, ma'am, your name, and your birthday?
I am Jermaine Tomas, 20 years of age, May 16, 2001.
So, may I check your name tag, ma'am? Okay, ma'am. Thank you po. So, today, ma'am, we are going to do the fundic height measurement, Leopold's maneuver, and fetal heart rate auscultation. So, the procedure will help us to determine the gestational age, the growing rate, and the fetal life in which the fetal home of the fetus or the baby is inside the mother's abdomen. So, it is essential to examine or assess your body birth. So, all you need to do, ma'am, is to lie down and put your hands on the side of the bed. And while I am doing the procedure, do you understand, ma'am?
Yes.
Okay, ma'am. Thank you po. So, before the procedure, ma'am, you can urinate first to empty your bladder. Are you going to urinate, ma'am, before the procedure?
Natatapos na.
Okay, ma'am. So, first, I am going to give you some privacy, and next is I am going to do the hand washing. So, next is we need to position the patient in a dorsal recumbent position, then place a pillow under the head for comfort, and place a small rolled towel on under the client's right hip, and ask the client to be still with arms in the side. So, ma'am, pabend na po natin. Okay, ma'am, so hands natin is sa color. Next is we need to drape the client with the draw sheet exposed from below the breast to the symphysis pubis. So next is we need to inspect the client for the following: scars, skin condition, striae, gravidarum, contour of the abdomen, or etc. Next is we need to determine the fundal height using the ulnar side of the palm. Measure the fundal height using a tape measure and stretch the tape across the abdomen's contour to the top of the fundus along the midline. maneuver, first we need to instruct the client to relax the abdominal muscle by bending the knees slightly and do relaxation breathing, reinforce the explanations given earlier. Next is use flat palmar surface of the fingers and not fingertips during palpation and keep fingers of hands together. Apply smooth and gentle deep pressure as firm as necessary. So for the first maneuver, stand at the client's height and face the client. Palpate the fundus using both hands. Curve the fingers around the uterus top and feel for the fetal part lying in the fundus. Use the palm, palpate for the size, shape, consistency, and mobility of the fundus fetal part. So for the second maneuver, place your hands on either side of the client's abdomen about midway between the symphysis pubis and the fundus. Move the hands on the sides of the abdomen with one hand in one place to steady the uterus. Use the other hand to palpate the uterus opposite side for the firm circular motions. Repeat the maneuver on the other side of the abdomen. So for the third maneuver, it is a pollex grip. Continue facing the client. Grasp the lower abdomen's portion immediately above the symphysis pubis between the thumb and the middle finger of one of your hands. For the fourth maneuver, face the client's feet and place your hands palmar surface on each side of the client's abdomen. Use both hands and palpate the fetal head using pressing downward gently with your fingertips about 2 inches above the inguinal ligament, or omit the fourth maneuver if the fetus is in breech presentation. So next is the fetal heart rate auscultation. So we need to place the bell side of the stethoscope chest piece on the fetus convex portion closest to the anterior uterine wall. Listen by pressing in firmly and very gently. Count a full minute holding the stethoscope chest piece while the other hand feels for the client's radial pulse. For the evaluation and documentation, document the procedure including the test performed and resulted in the client record using forms or checklists supplemented by narrative notes when appropriate. Notify the healthcare facility responsible regarding the results. Inform the client regarding the findings, and lastly, teach the client how to do proper follow-up and provide other appropriate instructions.